you move on from...
The COVID-19 pandemic impacted all aspects of life in Uganda, resulting from school closure, loss of jobs, and disruption in access to health and social services. But no group was affected more than the adolescent girls. According to a report published by UNFPA, 354,736 teenage pregnancies were registered in 2020 and 1,096,499 in the first 6 months of 2021. According to a police report of 2021, 14,220 children were defiled throughout the country. While presenting her research on teens affected by pregnancy following the COVID-19 lockdown, Dr. Viola Nyakato of Mbarara University explained that policies to allow young mothers back into school are inadequate.
We are seeing our policies on shelf, and one of the reasons is that policies are abstract and they are delinked. And are linked on evidence. And so when you go down to implement, it becomes difficult. Like now, the Interreligious Council was sharing with us how the guidelines were made, and to implement them. For example, if you say girls go back to school, there is no daycare center, there is no one who cares for the child she has given to. This child needs food. So when you go back to implement, then you're shocked with the evidence.
And what I'm also hearing is that we have some good actions taking place in Uganda, but that they are patchy. And that in some ways what is needed is a more comprehensive approach, which is looking at synergies.
We have several policies, good ones, but it's stop in papers. And I think this research will bring us to another level, that we have to take action, massive and deliberate action.
Dr. Nyakato adds that it's time to change the mindset and approach on how we address issues affecting the girl child.
But we have transited into a new set of structure. So the attitude, when we are talking about attitude change, is that we have to put into perspective what has changed. Because these girls are not prepared. Sex education was preparation for marriage.
She called for a national strategy and agenda to keep the girls in school.
Talking about special needs education. If we looked at adolescent school return as a special needs education, then we put their needs there, address them, and get them back into the system.
In response, the Minister of Children Affairs, Sarah Mateke, spoke of the importance of birth certificates as one of the ways to manage cases of rape when in court.
I request that if you have your birth certificate, you have all the evidence to show that your child is below 18 years. If you do not have this evidence, then it is very hard for us to continue with the case, because if someone says this child is 20 years, you may not challenge it because you don't have any evidence.
You have perpetrators who are going unpunished, and that to me was a really key issue that was raised today. Can we effectively deal with the perpetrators of what we're actually hearing about is rape and defilement?
The research recommends that parents, schools and community leaders need to develop protective social norms that do not tolerate sexual gender-based violence. Aaron Mukama, NTV Weekend Edition.